Good afternoon to everybody. At the outset, I would like to congratulate all of you for being successfully completed the first MBBS professional examination. So today, it is an introductory class. I will let us introduce ourselves first. Then I will very briefly introduce the subject forensic medicine and toxicology to you. For me, it is written over here, I am Dr. Ranjit Kumar, Professor and Head, Department of Forensic Medicine and Toxicology, Tripura Santiniketan Medical College. So today, I said, I will very briefly introduce you the subject of forensic medicine and toxicology. What is this subject? So this introductory lecture, it will cover the competencies 1 and 2. And here I will tell you so many definitions and a bit history of the forensic medicine. These are invariably asked in exam and also in viva. These are very important. And from beginning, I am telling you, it is very difficult to remember the definitions in forensic medicine. So you have to revise it. For me also, I cannot remember all the definitions. Since long I have been teaching the students. So you have to, for forensic medicine, you have to revise. It is a very subject because you won't get any interest because you have to remember everything, you have to remember by heart. Otherwise, you cannot do well in exam. So it includes competencies 1, that is basic forensic medicine and history of forensic medicine. The 1.1 and 1.2. I cannot go competency-wise in all classes because it is very difficult. So I will tell the competencies what are to be taught on one subject. Suppose if I take, next is forensic medicine. There are two distinct aspects of law and medicine relationship. They are very closely related, but they are different subjects. So what is forensic medicine? These are invariably asked in exam, especially in viva. Whenever you will enter, examiner will ask, you define forensic medicine. So at least 50% of students will be asked what is forensic medicine, especially in your stage. And these are very difficult to remember. You have to revise repeatedly. For me also, I cannot remember so many definitions. I fumble. So it happens. If you do not read. For me, we do not read nowadays. I say, what is forensic medicine? Forensic medicine deals with application of medical knowledge to aid in the administration of justice. Application of medical knowledge, whatever you acquire knowledge throughout your career in MBBS or MD or DM, whatever it may be. So, application of medical knowledge to aid in the administration of justice. Means you have to help for justice. You will help the court and police personnel. So, this is used by legal authorities to solve legal problems. As for example, in applying medical knowledge, in deciding the cases of injuries, accident, then assault, like sexual assault cases, then poisoning, all these are included in examination. If you come on, go on coming one after another, then the teacher get disturbed, no? There is one thing. So this is, in short, forensic medicine. Whether I should repeat it or you have understood it, forensic medicine deals with application of medical knowledge to aid in the administration of justice. It is used by legal authorities for solving legal problems. Suppose in deciding the cases, applying medical knowledge, in deciding the cases of injuries, then accident, suicide, murder, sexual assault cases, poisoning cases, etc. So this is in short for a definition of forensic medicine. Another definition is medical jurisprudence. What is medical jurisprudence? Medical jurisprudence deals with legal problems especially in reference to those arising from legal problems which are especially in reference especially in reference to doctors and patient relationship. Okay? As for example, the medical negligence cases, then severe professional misconduct, consent, rights and duty of doctors, then medical ethics, all these are included in this. So what is medical jurisprudence? Medical jurisprudence is, in short, medical jurisprudence deals with the legal aspects of practice of medicine. You will say in short, legal aspects of practice of medicine. Okay? So here one example is given for this medical jurisprudence, as I said, medical negligence. So what happened? Few years back, one woman expired in IGM hospital. You know the IGM hospital, it is in the Agartala, city of Agartala, and it is a state hospital.
It's our teaching hospital, sir.
You teaching hospital for the time being. Yeah. For the time being, for 2-3 years, then it will start over here. Teaching will shift it over here. Now it will start, now slowly the OPD will start and IPD will start, then teaching will be done over here. Okay? But for the time being, it is in IGM, you know. Very nice. So, few years back, one woman expired in IGM hospital after giving birth of a baby normal vaginally. And the patient party, she was all right after giving birth in the labor room, and she was shifted to ward. And there she started having bleeding, PB, profuse bleeding. And her relatives approached the sister in charge on duty, and the doctors concerned on duty, and nobody turned up. And the patient ultimately died of profuse bleeding, PB. So the party filed a FIR at West Agartala PS, and police arrested the medical officer and the nursing staff who are on duty on that particular time of day. And of course they were released after a few hours, but the criminal proceeding was on. And ultimately they were punished by the court of law, and court imposed fine of few lakhs on each of them. Okay? So now other important terms. What is forensic pathology? Forensic pathology deals with study and application of effects of violence in its different forms or unnatural disease. As I said, forensic medicine, forensic pathology is the study and implementation effects of violence or unnatural disease in its various form on the human body in determination of cause and manner of death. In cases of sudden, suspicious, unexpected, and medically unattended death. Should I repeat it or? Forensic pathology is the study and the application of effects of violence or other unnatural cases on the human being in determining the cause and manner of death in cases of sudden, suspicious, unexplained, and medically unattended death. Okay? This is the forensic pathology. What is medical ethics? Another term is the medical ethics. Medical ethics are some moral principles which will guide the members of medical profession in their dealing with each other, their patients, and the state. You should know what is medical ethics. Medical ethics are the moral principles which will guide the members of medical profession to deal with each other, to deal with their colleagues and the patient and the state. Then what is medical etiquette? Another term is there, medical etiquette. Medical etiquette is a conventional law of courtesy observed between the members of medical profession. Here, see, it is in our time it was there. I don't know new generation what they are doing, but we used to respect even one class our colleague who are one class senior to us. So that time it was there, and we used to learn from them. When we went for admission, they took all the responsibilities for admitting us. Our guardian went with us, but they have done everything for us. And even they also helped us by giving books and all. And whenever we do not understand anything, if you approach them, and they used to take time and make us understand the thing. So in medical science, it is very much important. So this in short, it will not come or what? These are some of the definitions you must remember, whether I left anything or not. Now, history, medicine and law have been related from ancient time, and the bond which united them is religion, superstition, and magic. Law and medicine problems are found in written form, written records in Egypt, Babylon, India, and China, dating back to 4000 to 3000 BC. A Chinese material media of 3000 BC gives information about the poison. Hippocrates, who is the father of Western medicine, he was there from 460 to 377 BC, was born and practiced in the island called Kos in Greece. And he discussed the lethality of the womb, and his contribution to medical ethics is by far the greatest in our field. Now, Choloka Samhita, about 7th century BC. See, regarding clinical forensic medicine, I want to highlight over here that our department, I am from AJMC. I was professor and head in AJMC. Only a few months back, I got retirement from there. And there we have clinical forensic medicine, which is established in trauma care center. And always there are 2 doctors are posted, forensic expert. They do the at least 24 hours duty, but they handle the complicated medical legal cases, and they help the junior medical officers who are working over there. So, suppose in clinical forensic medicine, if an injured patient comes to you in the emergency block where you are sitting for duty, then you have to see the patient. If a patient comes with assault or any road traffic accident, you have to examine the patient and you have to record, because you have to prepare a medical legal report. So you have to record all the injuries. Suppose some injuries are abrasion, contusion, laceration, inside zone, whatever may be. You have to make document. You have to prepare the report, and 1, 2, 3, 4, 5 like that. And you will write whether these are antemortem, age of injury, whether it is antemortem or postmortem, and what is the age of injury. So these all things should be written, and you have to make this as the medical legal report. So you have to make the medical legal report. If a sexual assault patient comes, then also you have to examine the patient. You have to keep the samples for investigation, and you have to make a report. Because first is making report, you have to make the report, but first concern is you have to treat the patient first, resuscitate the patient if the patient is in bad shape. Then you will prepare the medical report. Then you may be summoned in the court if the case goes to court, and there you have to give the evidence in the court of law. See, in India, actually only 2 to 5% cases, medical legal cases, are being examined by the forensic expert. 97 to 98% cases are being examined by the registered medical practitioner, those who are MBBS, MD, or whatever may be. Now, Charaka Samhita, about 7th century BC, lays down an elaborate code regarding the training, duties, privilege, and social status of physicians. It gives detailed description of various poisons and their treatment. If I talk by seeing that type, whether you can hear, whether it is coming. Okay. Now, Meno, king and lawgiver in 4th century BC, in his theatre as Monosriti, laid down various laws including punishments for various sexual offences and other offences, and recognized mental incapacity due to intoxication, illness, and age. Arthashastra Kutulia, between 4th and 3rd century BC, defined penal, it is not inner, penal laws and regulated medical practice. Physicians are penalized for negligence. Medical knowledge was utilized for the purpose of law. It mentions about the examination of dead bodies in unnatural deaths, abortion, sexual offences, and kidnapping, etc., were punishable offence. Okay? Sushruta, you have heard now the name of Sushruta and Charaka. Sushruta is a father of Indian surgery between 200 to 300 AD. In his theatres, Sushruta Samhita dealt with various medical legal problems. He defined the duties of physician and wounds, fractures, and also classified the poison, snake, so also classified, and treatment prescribed. Modes of administration of poison also described. Now, in 6th century AD, Justinian court, a Roman emperor, and institute regulated the practice of medicine and surgery and established the function of medical expert for legal procedure. Next slide. Next slide. So, the first book of forensic medicine was published in 1602 by Fortunato Fedel. He is an Italian physician. The great works of all was questionnaire medical legals. It is medical legal questions written by Paulus Josias, who was principal physician of Innocent X and Alexander VII, and expert Romana, the Court of Appeal. This was published in 7 volumes from 1621 to 1635. 2 additional volumes also published in 1566. The work remained the authority in medical legal matters until the beginning of 19th century. From this on, now you have to remember all those things. Next slide. Paulus Josias is considered the father of legal medicine and as well as father of forensic psychiatry. Around the 16th century, autopsies in medical cases began to be generally practiced. Autopsy means postmortem. Postmortems are being conducted in unnatural deaths. Suppose road accident, hanging, all those cases. First medical legal autopsies was conducted by Bologna in Italy in 1302 by Bartolomeo di Marignana. It is reported that first medical legal postmortem examination was done by Dr. Bartley in Madras, now Chennai, in 1693. Then Dr. Hamilton conducted autopsy in Calcutta in 1725. Next slide. Toxicology. What is toxicology? Toxicology is a branch of science dealing with properties, action, fatal dose, detection, estimation, and interpretation of results of toxicology analysis. Okay, this is called toxicology. Toxicology is a branch of science dealing with properties, action, fatal dose, detection, estimation of, and interpretation of results of toxicological analysis. This is called toxicology. Toxicology, again, there is another, it is main toxicology, then another is forensic toxicology. What is forensic toxicology? Forensic toxicology is the harmful effects of chemical on the human beings. Harmful effects of chemicals on the human being is called forensic toxicology. It is legal and medical legal. Now, what is the definition of poison? So here there are 3 definitions. No? One is forensic. One is toxicology. One is forensic toxicology. Another is poison. What is poison? Poison is any substance. It may be liquid, gas, or solid, which, if introduced into the body or brought in contact with any part of the body, it will cause ill health and death by its constitutional and local effects, or both. So this you have to remember. This you may be asked in exam. Definition of poison. The definition is, it is actually, it is a vague definition. Even small amount of poison may be harmless to a body, but when it is given in large doses, it may cause ill health and death. Suppose, as for example, if a person takes 1 pack of alcohol, it is not so much harmful to the body. But if he takes a 750 ml of alcohol at a very short time, then it will cause ill health and death. Okay? Now, in history, Orfila in 787 to 1853, he was the professor of chemistry and legal medicine at Paris, introduced precise chemical methods into toxicology, and he is considered the founder of modern toxicology. You will become a doctor after few years, after 2 to 3 years, no? Then you must know what is your legal responsibilities towards your patients. The general people are nowadays fast becoming law concerns, and doctors are being sued in the courts of law for their act of omission and commission. Therefore, doctors should have a good knowledge regarding the laws governing our profession. In order not to transgress the law, we go beyond the law. So we should have a thorough knowledge about the laws governing our profession, so as to not to transgress the law, that is, go beyond the law. Next, whatever degree you obtain, MCH, DM, whatever it may be, you cannot avoid medical legal responsibilities. Plenty of patients will come, and you have to deal them with your own responsibilities. Nobody will going to help you, your senior, your colleague, and your teacher. And you have to prepare the medical report by yourself. And if being summoned, you have to go to the court to depose the case. So, I am giving one example of Dr. Ratin Dotto. You will not know it, but those who are from Tripura, their father, or they will know. Because what happened, he was actually triple FRCS at that time. He expired at the age of 92 or like that, few years back. Because basically he was in central service, and he was deputed to Tripura, because Tripura there were hardly any medical officers or doctors from Tripura itself. Only few doctors were there. Doctors used to come from Guwahati, then Silchar and all, and from central service. So Ratin Dotto was posted over here, and while he was doing his FRCS from Edinburgh, Glasgow and London, when he was doing his FRCS in London, he was sitting in emergency in one evening, and one young man of 22 years old came to the emergency with a history that he is having some headache, and he was struck by a cricket ball on his head. So Dr. Dotto, he examined him and requested him to get admitted in the hospital for observation. But the patient refused. You cannot force any patient for admission. You cannot, by force, you cannot give any treatment. Only in criminal cases you can give for the criminal forceful feeding and all. These are being done. But as such, as per Indian law, if a person above 18 years of age refuses to take admission or take treatment, you cannot force. Then what happened? The patient went back to home, and in the next morning, he was being brought dead in the casualty. And Dotto was not there at that time. He was in the evening duty up to 8 or like that. And there was a huge hue and cry that one doctor from India, he was doing the duty, and he did not examine the patient and did not take care of the patient, and patient expired. So Ratin Dotto, after that, he showed that what he did in the admission register or exchange register, he has written refused admission and took his signature. And then by showing that, he was escaped from this incident. Okay? So this is very important. You are so much intelligent, extraordinary fellow. I worked with him. He is extraordinary, brilliant. He is in Tripura. He is known as God. People used to worship him like a god. So one should be very much careful while dealing with medical cases. Slight mistake of a doctor may convict innocent persons or at the same time equate a criminal. So you should be very much sincere while preparing medical report. So books to be consulted. These are the books. K.S. Narayan Reddy, it is a very good book. Then Anil Agarwal, it is for reference. If you do not understand any of the chapter or anything, then you can refer to Anil Agarwal. Then B.B. Pillai and Gautam Vishas. It is a bit easy. You can read that. That also are being read by many students. Mainly, I recommend K.S. Narayan Reddy. It is a very good book and it covers everything. And for practical, R.N. Karmakar is there. It is a very good book. We also read R.N. Karmakar. Okay? So this book you purchase by yourself or library also it will be coming. I have given the regulation. But you purchase for yourself to read at home. Purchase book. Don't see all the time on. Don't depend upon the other sources of reading, online reading and all like that. But you have to read the textbook. Then you will understand the subject properly. Otherwise, by reading this and that, it won't be helpful. Thank you.